Now back to that story we were telling you at the beginning of the newscast. The governor mandating a 4% cut for most state departments. That includes Hawaii's public hospitals. Doctors say it'll cripple the state's already fragile health care system. We want to go now to KHNL News 8's Leland Kim with the late-breaking details on this story. Leland?
Dash, the 4% cut is effective immediately, which means struggling neighbor island hospitals have an even tougher road ahead. 55 fewer employees at a hospital struggling to get by.
These are very tough to deal with.
But this could be just the beginning of further cuts to Hawaii's healthcare system. Governor Lingle's mandatory 4% cut affects most state departments, including public hospitals.
There's basically no fat at Kona Hospital to begin with, so these are people who are doing real meaningful work up there.
A couple of weeks ago, Medicare cut reimbursements to Hawaii physicians by 10%. So cuts on top of more cuts could mean disaster.
So I'm urging the governor to not cut. In fact, we need to put more money into the healthcare system so the neighbor islands continue to give care to the people.
This comes as neighbor islands struggle to attract and keep doctors.
For a physician to come to Kona and deal with the lowest reimbursement, the highest cost of doing business, and instability at the hospital obviously would be a very tough sell.
Neighbor island doctors say they and their patients are suffering because politics tend to be Oahu-centric.
There's absolutely no question that Oahu politicians need to come and spend time on the neighbor islands. They need to seek care on the neighbor islands, and then they'll see that these cuts are unfeasible.
A growing, prospering, fully employed community like West Hawaii should not have any problem attracting and retaining physicians and having a safety net hospital that functions well. And there's something really wrong with the fundamentals when this kind of thing happens again and again.
Again, neighbor island doctors say even deeper cuts are unrealistic and, if implemented, could shut down some hospitals. Almost all state departments are impacted by the 4% cuts. The exceptions include the legislature and the Office of Hawaiian Affairs. Reporting live, Leland Kim, KHNL News 8.